Hello and welcome to CATAnetTV. This is our new specialty channel devoted solely to mobile health issues. My name's David Farnes and I'm the mobile health lead at CATA. Joining me today is Jackie Ellis. She is President and CEO of Clinical Evaluation Online. And Jackie's joining us today to chat about iDoseCheck, a new innovation of hers. So Jackie, welcome to CATAnetTV. And would you tell us a little bit about your innovation?
Thank you very much, David, for having me. iDoseCheck is a safe dosing software that nurses use when they prepare high alert drugs. So, for example, morphine is a high alert drug, and if you overdose a patient with morphine, and we know that 5- and 10-fold overdoses errors have been made, it can be fatal to the patient. So right now, iDoseCheck is, we have a prototype that's 2 milligrams per milliliter of morphine, and it's for pediatrics. The reason it's for pediatrics is you enter the patient's weight and you enter the dose that the physician has ordered, and it gives you a series of iDoseCheck provides you with a series of visual cues indicating that yes, that's a proper dose, or no, that is an under or an overdose. Pediatric dosing is by weight, and it's typically milligrams per kilogram. So the iDoseCheck came from a series of studies that I did with a team of researchers from Carleton University. They were human factors engineers, IT professionals, myself from the University of Ottawa School of Nursing, and then nurses, pharmacists, and physicians at CHEO. And we started the process by watching nurses as they we took a human factors approach, and we observed nurses as they gave morphine to identify risk factors in all of the chain of events that happen by looking at an order, going to the medication room, and providing that dose of morphine. And one process in that chain of events is called the independent double check, where two nurses independently calculate the dose of morphine. Typically, they use paper and pencil and a calculator. The two nurses come back together and they check the dose. We noticed that there were many process variations in that very small process. Lots of interruptions, lots of distractions, fatigue, lighting, noise, all of those factors were risk factors that possibly introduced error. So based on my sort of knowledge of people playing video games, I decided there must be some sort of engaging visuals that we could, and technology that we could bring to the process such that nurses would be engaged in sort of a safety technology, a safety sort of software that would help them stop and say, oh no, I've made an error here. And that's what makes iDoseCheck different from a typical drug calculator, is that it actually shows you the ampule or the vial of the drug you're using. It's an accurate picture, plus it shows you what it should look like in the syringe in terms of how much drug is in the syringe. There are error messages, so if it's an overdose or an underdose, you get an error message. What makes this so powerful, I think, is that we work with human factors engineers. Human factors engineers are wonderful in that they really look at how humans and technology sort of where the rubber hits the road, how do they work together? And they're very, very specific about color, about warning messages, about placement, where your eye moves when you first look at a computer screen. So I think that was very useful.
Thanks for the overview, Jackie. So tell us a little bit about your experience trying to bring iDoseCheck to market. What has helped you? What has aided you along the way? And what obstacles have you encountered?
We were trying to bring iDoseCheck from a purely academic environment where it was a research tool. We have some data to show that it has good usability. Nurses like to use it, increases their confidence, etc. So we know that. But right now we have a prototype which we are launching in January as an app, and it'll be morphine 2 and 10 milligrams. But what's been, of course, a stumbling block a little bit is that we're going from the academic world to the business world. So there's just because you have a good idea doesn't really mean anybody's going to buy it. So I'm the CEO of this small startup company, and we're really trying to understand the business world. I've had great help from Invest Ottawa in terms of working with an entrepreneur in residence to help really try and understand the business world. So For me, that's one issue, is understanding business. The second issue is hospitals are very, very slow to change, right? They're very worried about risk. So if you bring in any sort of new technology to a hospital, they want to know, is bringing in this new technology going to cause error? They're not really lean, mean changing machines. They want to have it all worked out. They want to know if this is going to cause error. They want it to be tested. And then their buying cycle is about 2 years. So it takes about 2 years, from what I understand, is to bring something to a hospital and to have them say, absolutely, here's the money, let's install this on all our machines in hospital. So what we're trying to do, just to get ourselves started, is put an app out there, and we will provide, our first app is going to be for nurses for free. After that, we will start charging as we bring more drugs on board, and we'd like to get nurses using it first, get feedback, see how they like it, and then after that sell it more broadly to hospitals.
Very interesting, Jackie. And as you know, at CATA, we launched the Mobile Health Advisory Board. We very much want to assist startups like yourself where we can and really promote the adoption of mobile technology in the delivery of healthcare in Canada. So, Jackie, thanks very much for joining us today and sharing your news with us. This is CATAnetTV, our new channel devoted entirely to mobile health issues. We'll have Jackie's contact information up on the CATAnetTV site, and stay tuned for more. Thank you for joining us.
Thank you very much.